Have you ever played video games or known someone who has? You do stuff, you get experience, then you level up and you get more powers. What if charting in medicine were similar? There's different levels from novice to amateur to professional to master. A person at each level faces the same charting, but has different thoughts, beliefs, and stories that they tell themselves. It's not so hard. I don't have enough time. I have to bring all this work home. Regardless of whether you like video games, what if I told you that there was a program to take you from where you are toward being that charting master? I want you to know there is hope. Charting Mastery is my 6-week coaching program to help you master charting. It's for physicians who want to feel confident in their charting, ditch the overwhelm, and leave work at work. The first cohort will start later this summer 2022. So if you want to know when doors open for this or subsequent cohorts, join the waitlist today. You can find that at chartingmastery.net. And now for the rest of today's episode. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stejink, general pediatrician and life coach for physicians. Welcome to another episode of the MedEdWell podcast. Thank you so much for subscribing and sharing these episodes. They are designed to help you take the next step in your wellness. I'm incorporating both guest and solo episodes, and I'm excited to have another guest with me today. Dr. Puja Aggarwal is an MD and MBA, a certified burnout and stress management coach, and board-certified neurologist and epileptologist. Dr. Aggarwal experienced burnout as a physician 5 years ago. She was overwhelmed, overworked, and tired. Through coaching, Dr. Aggarwal learned to change her mindset and became more self-aware to realize what her priorities were and to set boundaries. Dr. Aggarwal certified at the Life Coach School in 2021 as a life coach. In 2021, she also started Zenful Brain Coaching to help female professionals with overcoming burnout and to help them lead an empowered life with fulfillment, fun, and freedom. She uses a neuroscience-based approach to help coach her clients to optimize the use of their brain. She also has her own podcast, Zenful Brain, where she discusses ways to optimize our brains to live a more mindful and empowered life. Welcome to the podcast, Dr. Aggarwal.
Dr. Stejink, thank you for having me.
Thanks so much for being here. Tell me a little bit more about your journey to medicine and how that ultimately led to some burnout.
My journey to medicine actually started in high school. I decided to join a 6-year combined undergrad MD program. So I started literally 2 weeks after high school. I started undergrad. I did my undergrad in 2 years instead of the normal 3 or 4 years. So took full credits through the summer, went to medical school. And so since I was a combined program, I was automatically accepted into medical school as long as I met some basic criteria. And then in medical school, I loved the brain. I loved neuroscience. My first year of medical school, I loved dissecting the brain and looking at actually all the pathways. And it really, that's what made me want to do neurology. And so I did my neurology residency at Ohio State. And then I practiced for a year as an attending because I wasn't really sure about fellowship, like what I wanted to do. And then I had an opportunity come up where I could do a fellowship at Cornell. So I interviewed, I took it, and I just seized on that opportunity. And I did a fellowship in epilepsy at Cornell. And then I was moved from there to Pittsburgh, where I was practicing at a major academic center. And I was about 2 years out of fellowship practicing as a full-time attending, on call 14 weeks a year. And, when you're attending, and when you're new, you're excited, you want to help people, and, you just want to give it your all. You want to give everything you have and just take care of patients, help them. And, I had that mentality and, I definitely still do. But I think taking 14 weeks of call a year and often taking call 2 weeks at a time back to back was really difficult. I think in the beginning, it was like all gung ho about it. But then I was like, wow, what did I get myself into? And, I was on inpatient neurology calls, so you could be called in to come into the ER, and then also EEG call. So EEG calls is for looking at our brain waves or for seizures. And EEG calls brutal when you don't have anybody looking at the EEG besides you as a physician. And I had no backup, no techs or anybody. So I was covering neuro ICUs, regular medical intensive care units for continuous EEGs. I was covering like stat EEGs. I was literally the only person available for like 7 days at a time to read EEGs for like, I don't know what it was, like 7 hospitals. And these are these are academic centers. So they're big, they have lots of patients. And so that was really one of the major factors that led to my burnout. Taking a lot of call. And then, it wasn't just like it was the 2 weeks on call. It was brutal. It was like the dread up to it. And then the week after, it's like the decompression and just like trying to get over it. And so it was like literally 4 weeks and then another week would come a call sometimes. So it was just like this pattern, this cycle of like working, not sleeping, not taking care of myself, not eating well, just eating whatever was around and was junk, and then not exercising. And then I was giving all of my time to work. I wasn't giving it to my little kids, to my husband, who's also a physician. And I was just irritable. I'd come home frustrated, upset, irritable. I'm just taking out on, family. And, it came to a day where I had little kids. I had a 3-year-old and a 2-year-old, and they were wanting to read a book with me. And it was at the end of the day. And I got so frustrated because I'm like, I just don't have anything left to give. And I felt so horrible because I kind of yelled at them, and they're like 2 and 3. And that I felt so horrible because then they were like upset, crying. And I was like, I can't do this. I can't continue. So I was like, this work job is really getting to me. So I tried to figure out ways I could change the job or ways I could, change. I thought, well, is there something wrong with me? And I felt like all alone. And this was before burnout came much more of a hot topic, which is within the last couple of years, or, few years. I think it was always there. It just wasn't really talked about. So I saw a physician. I'm like, well, what's wrong with me? Well, that didn't really help me. I saw a counselor. That didn't really help me. And then I hired a coach. And, I was new to coaching, never really heard about it, but coaching really gave me the tools to change my mindset, to learn who I was, what I wanted, and to make myself a priority. And I saw the need during the pandemic for a lot of high achieving working moms or female professionals that burnout was ever present. There was a recent survey out of Ohio State University where I did my residency that looked at parental burnout. It was really high, 66% among working moms. And that's so high. And so, I saw this need. And so I thought, well, I had coaching. It really helped me. I want to become a coach and help people. So I got certified at the Life Coach School. I started my business, Zenful Brain Coaching. And now I help high achieving working moms with burnout.
Thanks so much for your vulnerability and just really sharing this path that so many of us take in medicine. It's like the passion for the science and for helping people and really wanting to make a difference, and then getting out of training and really wanting to jump in and get started and to do the work. But then sometimes just the situations that we end up in are really overwhelming. And I just heard how that self-care piece was getting lost, which is so ironic when we're caring for others. How did you deal with that? And how did coaching really help turn that around for you?
So coaching really helped me with becoming more self-aware, more mindful. So I was, very pessimistic during burnout. And it wasn't, I wouldn't say like a temporary, it's more of like a chronic. I probably had it for at least a year or so. And I felt like I was alone, and I felt like, well, why am I so irritable? And what coaching did was, like I said, change my mindset. It made me more self-aware. So I started to reframe my thoughts. I used to think, well, I hate going to work, I dread it. And then started to think that, well, I get to go to work, or I want to go to work. And then also with that then came my ability to make the decision, do I need to stay in this job or do I need to leave? Because, with that job, unfortunately, they were not allowing me to to change my contract. There were, after 2 years, there was no increase in salary, no decrease in call. There was nothing to try to make it better. And, so I left. I was supposed to give 6 months notice. I gave 6 weeks notice because I'm like, I can't continue for 6 months. I just can't do it. So anyway, I left. I went to telemedicine, which was a huge change. And I saw the coaching, and then coaching helped me to practice that self-care, exercise, eat better. And with the telemedicine, I was working about 10, 12-hour shifts a month. And so I was making about what I was making full-time practice. And I had that time to exercise, to do other things outside of medicine. And that was a good change for me. And I love telemedicine. And this was before the pandemic. So telemedicine at this point, in 2016 was still kind of a newer thing, but for stroke and things like that, it's very big and very helpful. And so I did telemedicine, and then I was doing some other things, some utilization management, just trying to dip my toes in some different waters to see what it was like. So I was in clinical practice. Then I stopped the telemedicine, and then I moved to Orlando a few years ago. And then I was working with the local health system and really doing inpatient neurology consults. And then I got certified as a coach. And then now I coach female professionals, but then also I am a principal investigator for clinical trials or research for neurodegenerative diseases. And so like Alzheimer's, Parkinson's. So it's corporate America, but I like that I get to still have patients or see subjects without the worry of meeting RVUs or without meeting targets. And I can form a bond with them, and I know them better than I would in clinical practice because I don't have that time constraint. And I get to do basic science, which, get back to that basic neuroscience. And, I really love combining that. And then I do still do a little bit of clinical practice just to keep up at the local hospital, a few shifts here or there. So I really like what I do now. And especially the coaching is something that I'm very passionate about, especially like I mentioned during the pandemic, there is a lot of burnout. It's increased significantly. And I want people to know that it's not something you need to continue to. There are no golden handcuffs. You don't have to continue in a job because the money that you're getting, there's other opportunities, other ways to make money, other jobs and things out there that will better align with who you are and what you want.
I think that's really helpful because in training, a lot of times you're just not exposed to those other opportunities, whether it's to be a clinical investigator, to pursue entrepreneurship, like to do locums. It's like either you work with someone who's potentially in an academic or community health system, and maybe you work with somebody who's in private practice, and that's about it. At least that was my experience as a general pediatrician. I didn't have that exposure to people who were doing coaching for other physicians and professionals, people who were working in industry, but still making a difference with their medical degree.
Yeah, I didn't really know much about it, even in fellowship or, it wasn't, my husband's a physician too. He did utilization management. He had a lot of experience with other stuff. So that really is what guided me away from the traditional clinical practice. And so really opened me up to a lot of different things. And, like I said, I really like working in research, but I really love coaching.
So as a neurologist and epileptologist, how have you seen and how do you have a unique perspective about how burnout affects the brain itself?
So yes, I think a lot of people think that burnout is more of like a physical and emotional and mental state that it affects those, but it actually affects your brain. There have been research studies that have shown, and what they're looking at is the functional MRI, are looking up, how burnout affects the brain. And so it has been shown that when you have burnout and when it's chronic burnout, then the amygdala, or the feeling center for people who aren't in medicine, who are maybe listening, that over time gets larger in burnout. And then you're more emotionally labile. You're more likely to get stressed out by non-stressful situations. You're more likely to react, whether it be getting upset easily, more irritable. And again, those are classic signs of burnout. And so that's one thing that research has shown. And then also with burnout, when you are experiencing it more in a chronic situation, then your hippocampus is affected, or your memory center, that actually gets thinner. And so then you you don't remember things as well. You can't focus as well. And then in addition, other things that are affected is our prefrontal cortex. That's our judgment center or our executive function. So that also thins over time. It makes you more impulsive, less likely to make decisions or make the right decisions for yourself. And so all of that fits with burnout, the symptoms of burnout.
Well, it's especially helpful to have that context when you then think about, okay, what are those subconscious thoughts and how do those affect your feelings? and then the behaviors and actions that you take. So that's really helpful. What things have you found particularly helpful, whether mindfulness or meditation, to actually make a difference in working through burnout? And in addition to some of those other changes where maybe you do need to consider whether this is the right job for you in this season, or you need to add some other interest. But what things have been helpful in your experience?
So for me personally, and also with my clients, I think that mindfulness is very important. And, I didn't really know about that or that self-awareness till I got coaching. And as you know, you're going through life coach school right now. I went through it certified last year. They give you a lot of thought work, really diving into what are you thinking and how is that causing you to feel and what actions are you taking because of that? And then what is the result of those actions? And that really then leads back to, well, this is a result. And it's because you're thinking, this thought, and really delving into that with my clients is really important. That brought me a lot of mindfulness and self-awareness, and that has helped my clients. And then, with that mindfulness, then comes the ability to know, who am I? What do I actually want? Do I want to do this or do I want to do that? And, then delving more into that, and then realizing, that is this job aligning with who I am, what I want? Or can I make it work? Can I change some things and see if they work? Or do I have to completely change jobs? And, sometimes people stay. You can experience burnout and get, the self-care, get the help that you need. Or the other thing is you can learn to set boundaries at work. You can learn to say no. You can learn to, make people aware that, you're not going to do all these extra tasks. You may be helpful in certain situations, but then you're not going to overwhelm yourself. And I really think that that's important. Learning to set boundaries. I think oftentimes we as physicians, if you're male or female, are more inclined to say yes because you're afraid of, what people think or how you'll be perceived. And so we'll say yes more easily. So the other thing is meditation that I work with my clients. So breath work. And I don't mean chanting or anything like that. All I mean is simply breath work. Just paying attention to taking a deep breath in, a deep breath out, and just bringing your mind to focus on your breathing. Doing that just even 5 minutes a day can really help you become more calm, have better mood. It can help with burnout, in addition to the mindfulness. And then the other thing I focus on with my clients is self-care. I'm not telling them what to do, but helping them guide what it is that they want to do that will make them feel better, whether that be exercise, whether it be journaling, practicing gratitude, or, eating healthy. What is it that will help benefit them? And then, actually, like I mentioned, research has shown that burnout affects the brain. So does mindfulness and meditation. Studies have shown, again, through functional MRI, that when you are more mindful and you're meditating and when it's happening on a daily basis, your amygdala is not as activated. And that amygdala does not get to that larger state as it does in burnout. And also then the prefrontal cortex, where it thins in burnout, you build new neural pathways in that prefrontal cortex. So your judgment is better. You're able to make those decisions. You're not more in like an overwhelmed state. And then also your hippocampus also forms new neural pathways. And so then you are able to think better. You're able to get those memories from whatever it is in the past that you want to, or retrieve those. And so that mindfulness and that meditation is kind of almost the opposite effect, if you want to think about it, compared to burnout.
It's really helpful just to think about, okay, this is really affecting your brain, and some of these chronic stress and how our training and other things have made it difficult to process some of these chronic stressors, or the moral injury of saying, I know what needs to happen for this patient, but I don't have the resources. We don't have the medicine, the staff, or whatever. But at the same time, figuring out how do we then get that outside input, whether it's colleagues and community, whether it's coaching, whether it's some of these practices like mindfulness and meditation, so that you can restore some of that ability. Because if you're burned out and your prefrontal cortex is impaired, you're not going to be able to make those decisions that are going to be what helps you move forward. And so I think just realizing that sometimes takes that input outside of oneself.
Yeah, I think burnout is not just due to a person or their situation or because of them. It is because also organized healthcare. It is because of that lack of autonomy. There's Christina Maslach, American social psychologist. There's 6 different things that cause burnout: lack of autonomy, lack of community, perceived lack of fairness, values mismatch. There's a couple other right now that I'm not able to pull out of my own memory, but there's a couple other. And so, I mean, it's really a combination of wanting everything to be perfect as a physician, obviously, and then also admin and things like that. And so, I mean, with burnout, really you do need to make yourself a priority and reevaluate, is this job going to work for you or is it not?
Yeah, no, I think that's really helpful for those listening to say, sure, there are some of these things that we can do as individuals, but I do not want anyone to feel blamed or shamed for going through this. It is so common in medicine. And I think we're just more aware of it now. And there are so many systems things, and why I'm really passionate about using some of the opportunities I've had to get some extra training with medical record optimization to say, okay, these are some things that individually we can do on the medical record side, but there are so many things that need to be addressed from the systems perspective. So it's not limited to just medical records, but there are definitely many system factors that as we have these conversations, we're then able to advocate for and to push for that change that's really needed in the culture of medicine.
Yeah, I mean, definitely it's the culture of medicine that's been like, we as physicians just need to do it all well. We shouldn't care about ourselves. We should put the patient first, is what we've always been taught. But we can't pour from an empty cup.
Yeah. So what is one thing that if you were to go back and tell yourself coming out of training, or someone who's listening who's early in their career and excited to jump in, what would you tell them as far as something to be aware of, some sort of self-care practice to incorporate, or things to look for in a current or a future job that they might be looking at?
So I would say, one self-care thing that I would recommend is meditation or breath work. That's very important to just help you your overall health, and if you're experiencing burnout or if you're not experiencing burnout. It's simple. All it takes is a few minutes, just simply paying attention to your breath. And that has really been shown to help in the long term. So in terms of people coming out of training, out of residency, looking for that job, I would say do your research. Talk to the people who are there currently. Talk to them away from, admin. See if you get their phone numbers. They're more likely to be honest if it's just you and them on the phone. I think that's really important because, I think with me, when I took the job where I was just out of fellowship, I didn't really know that I should have asked that. I should have gotten their numbers. I should have learned more about the position. And I didn't know that I could necessarily negotiate call or things like that. And the other thing is you can negotiate. Things are open for negotiation. Everything is open for negotiation. They may say it's not, but it is. At least, the other thing is if you don't ask, you're never going to know. And the worst that people can say is no. The worst answer you can get to asking for something in negotiations is no. So really, there's always room open for negotiation. So always try to negotiate.
I think that's really helpful. Coming out of training, I was put at 2 separate clinics in my system, and that had its own opportunities, but also its own challenges. And I realized over time that I needed to be all at one. And so, how do you advocate and negotiate and try and make your case in ways that speak to either the metrics they're looking at or just kind of speak that language that they're looking at. And I think what you're saying about trying to get input from various people and is really helpful, because you don't know what you don't know, but both having mentors and having those contacts, I think, could be really invaluable.
Yeah, the other thing, like you mentioned, because of having mentors, like networking is so important. So you can have those people to bounce ideas off of if they're in your field, or have those colleagues for any future jobs, maybe if you need a reference or if you need, whatever it is, networking is also very important.
Well, I so appreciate you coming on the podcast, Dr. Aggarwal. If someone's wanting to learn more about your podcast, the work you do, wants to work with you, where would they find you?
So you can find me on my website. It's www.zenfulbrain.com. That's ZENFULBRAIN.com. You can find me on Instagram. It's at @ZenfulBrainOfficial. And then actually on my website, they can schedule a free strategy session.
Great. Thanks so much, everyone, for joining us. I hope you found value from this conversation and hearing about Dr. Aggarwal's expertise. I want to hear from you about what you think about doing solo shows versus guests, and maybe even guests that you'd like to have be a part of the show. If you'd like to be a guest as well, please reach out. And again, I want you to take your next step. So decide what you're going to implement. Is that going to be starting to do some meditation, some breath work, just having a gratitude practice? Take that next step and then share this episode with someone, a physician you know, a colleague, someone who really needs to hear this. Thanks so much for all you do, and have a great day. And now for our important disclaimer. Dr. Ryan Stejink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.